Hello, I'm Michelle Ross and the founder and director of CliniQ. Came out in 1966, however, my involvement in health started in 1988 when I joined Terence Higgins Trust. And I didn't join Terence Higgins Trust because, oh, I'm trans, I must do something. It was actually a response that I needed to do something. Believe me, I spent 18 years in that very building, and so many people left us, so many people died, so many people passed on in the early days of HIV. There was no medication, really. And the type of medication, AZT, wasn't being great with people's health. So anyway, and the early days of HIV, there was no sexual health services for gay men, for gay and bi men. Let's talk about that for a minute, because it was the community's response to HIV, the LGBTQ community response to HIV, that changed the way sexual health services were for queer people, for LGBTQ people, not so much the trans. At that time, the health services weren't changed, didn't include trans people at that time. But what mattered was we were responding to a crisis. And that crisis was mainly impacting on gay and bi men, cis gay and bi men, because the aspect of trans was more invisible in those days. I had the idea for a space. Didn't have a name, didn't have a look, didn't have a feel really, other than a sense of wanting a space where people could come along and talk about sexual health, because I knew from my own involvement in sexual health services that trans people were not having a great time at all and weren't going back and being asked all sorts of intrusive, unnecessary questions. And I was delivering in-house training at Terence Higgins Trust from 2006. And out of that came a real need for more people in sexual health and HIV to be aware of the very real issues for trans people, and they were not being included. Trans people were not being included in HIV or sexual health information. So in 2010, I had an idea. I was really passionate about getting a space, even if it's just a room, come and talk and about their sexual health and about their HIV issues. And out of that, I was introduced to people in Soho. And anyway, out of those conversations came a space that we were offered, and we grabbed it. And we were there for 7 years. And it was the first of our kind ever in the whole of UK and Europe. And honestly, actually, for the first month, hardly anyone came. Well, why would they? Because it's about trust. And why should they trust people they don't know? So we started reaching out to our communities, going to organizations, going to events, and saying, this is who we are. And then we started inviting people around to come and see who we are. Just check out, have a cup of coffee, a cup of tea, chat with us. You have to have a service if you don't like us. And then people started coming and coming and coming. I don't want to keep saying, oh, I did the first this and I did the first that. Because all the sector, everyone involved in a health service, it's a team. It's not just an I did this and I did that. It's a whole team of people. When someone's doing something, there's a whole team around them. And I don't want to make that team invisible. And that's where my passion lies, really. Well, my passion lies mainly in HIV and sexual health, but I knew that trans people needed more than that. So we had to make sure that people were able to get hormone level blood tests from the get-go, from straight away. Because we knew that a lot of people were self-medding. When, 50 years ago, I self-medded. It was different then. It was just friends giving each other their spare hormones, and especially if they had lower surgery, because in those days we were told you don't need hormones anymore. What a load of nonsense that was. But so we got it, but we wanted people to do this safely. because we knew people were taking all sorts of stuff, piling it on, wanting effects really quickly. And I don't blame them, but it's not always healthy. It can damage you. But by 2012, we started delivering services in partnership with the NHS for the organisation that is CliniQ. But we were having 35 people coming on a Tuesday service within 3 hours to see that many people. It's just not able to continue at that level. And that was on every week, 30, 35 people coming for all different services, sometimes complex issues and needs within one appointment. And people were waiting, and there was queues round out the door, not round the corner, but down the road, for people to get in. And so we had to change it to appointments for now. For me, the future isn't CliniQ or anything like us. The future is where people live, and it's in GP services. And one of my questions when I present to professionals, how far do you want to travel for a blood test? Do you want to travel, so you go to your GP, they tell you to go for a blood test. How far do you expect to travel? A mile? 5 miles? 10 miles? 100 miles? Because that's what some trans people are doing. They're traveling 100 or 200 miles to come and get an appointment for 15 minutes for the blood test where their hormone levels are, because they're not being done locally and they're being refused locally. And to get that blood test takes 15 minutes, and then they have to travel back 100 or 200 miles. How is that ever right? We did an afternoon for GPs, only for GPs and primary care services, about 2 years ago, soon after lockdown. And it was really, people were passionate. GPs were interested, but one set of GPs and other primary care that worked together were really passionate about changing. And they're now called the Bridge. And I will always talk about them, because for me, that is the future, really. And they prescribe, they can do they send us for the blood test, or they get the blood test done. And they can refer into other services, like for surgery, if needed. People don't like travelling on transport, or don't have the funds to travel 100 miles to get a sample blood test. But sometimes they are required to have those blood tests to continue receiving their hormones. And if their GPs are not doing that, where do they go? They go to places like CliniQ.